Hello, everyone, and welcome. We're thrilled to have you today to join us for this exclusive SpinSci webinar titled The Future of Patient Engagement, Seamless Patient Journeys from Start to Finish. With me today, I have Ashwin Asava, who's our Chief Revenue Officer at SpinSci, and also Bill Eliopoulos, who's a SpinSci Solution Architect. As a quick intro into today's topic, today we'll be diving into SpinSci's ability to provide automation via EHR interoperability, exploring how SpinSci can enable workflow optimization across the entire patient journey. There are really three common threads that you'll pick up on as we traverse today's session. Excuse me. Number one, workforce enablement and optimization. Number two, utilizing AI and automation to increase speed to care and agent productivity. And number three, and last but certainly not least, is our ability to enhance the patient experience. At SpinSci, we've worked with over 100 healthcare organizations using all of our learnings and experiences to create a very configurable yet robust product portfolio. Now, this session is especially important because there are a variety of common challenges and trends that we've worked to solve with our customer base. As some examples, and some of the key common metrics that you'll hear within the contact center, reducing the average call handle time. Without the necessary enablement, agents may require additional time or steps to appropriately triage a patient. Reaching a live agent. 45% of patients have said that this can be quite challenging when needing to engage with a live advocate to handle more complex inquiries. Additional pain points tied to the contact center specifically include 51% of patients referred to having to answer too many repetitive questions. And then 40% of those patients stated that they spend too much time authenticating their identity. With those in mind, let's take a quick step outside of the contact center and look at some common challenges that patients face when looking to self-serve in healthcare. 61% of patients say the availability of online appointment scheduling is extremely important when choosing their provider. Interest in self-service goes beyond scheduling. 93% of patients are extremely interested in self-service capabilities to find provider location information, refill prescriptions, provide and verify insurance coverage, and/or make payments. As a matter of fact, when it comes to paying a bill, 69% of patients consider this functionality as a key deciding factor when choosing their provider. All of these challenges will be addressed in today's session, and we will showcase SpinSci's ability to positively impact these metrics. As you can tell, at SpinSci, we're very passionate about empowering healthcare organizations with innovative tools to transform how patients interact with their care system. In this session, we'll take a closer look at how EHR interoperability is breaking down silos to deliver that seamless communication between patients and providers, the role of automation, and how it can provide significant time savings and enable your workforce to deliver the highest quality of care. And lastly, how our EHR integrated self-service solutions empower patients to control their own healthcare routines, from scheduling appointments to refilling prescriptions to accessing critical information. We will share real-world insights and practical strategies to help your organization enhance the patient experience and drive better outcomes. Also, stay tuned until the end for a quick question and answer session where we'll be covering your questions live. So don't hesitate to drop any questions in the chat. Without further ado, let's go ahead and dive in. First on our agenda is Bill, who will be showcasing how SpinSci is transforming self-service in healthcare.
Right, let me call into the demo here.
Hi, I'm your virtual healthcare assistant, Eva. How can I assist you today?
Yeah, can you tell me what my upcoming appointments are for the next week?
Get you authenticated. Can I please have your date of birth?
Yeah, my date of birth is September 29th, 1963.
And can I have your zip code?
Yeah, my zip code is 01475.
Welcome back, August. Your authentication is complete. I see you have 3 appointments coming up in the next 7 days. Appointment 1 is on Monday with Dr. Eason, your primary care physician, at 10:30 a.m. in the Portland office. The next appointment is Wednesday for an MRI at 12:45 p.m. at our Ocean City facility. The last appointment is with your cardiologist, Dr. Blomberg, on Friday at 3:30 p.m. in the Portland office. Is there anything else I can do for you?
Yeah, I need to cancel one of those appointments.
Which appointment is canceled?
Cancel the MRI, please. Yeah, I need to refill my prescription 1, 2, 3, 4, 5, 6, 7.
Bill, we can't hear it.
7 is in process and you have 3 refills left. We see that your preference for pickup is in-store pickup. However, we also provide mail order delivery. Would you like to change your pickup preference?
No.
Preference not changed. What else can I help you with?
Yeah, I need to pay my bill.
I see that you have an outstanding balance of $98 due in 5 days. Would you like to use the HSA card we have on file to pay this bill?
Yes, please. You can use that card.
Your bill had been paid in full. Is there anything else I can do for you?
You know, I'm locked out of my chart and I really need to reset my password.
We are going to send you a link with your temporary password that will be valid for 20 minutes. Is there anything else I can do for you today?
Yeah, can you transfer me to someone that can help me transfer me to an agent, please?
Please hold while I transfer your call to an agent who can assist.
All right. Well, Phil showed the self-service experience, and what I want to do now is I want to kind of walk through what does it look like from an agent perspective. Again, we don't just have self-service, but we also have the full service as well that works very nicely with the self-service components as well. And so you can see right here that we got Spinsci August as the patient of source, which is the caller, and the patient of interest, which is who the patient context is around. Notice this verified tag. This verified tag is built with all the different. See that we have a node inside of the self-service virtual assistant that's able to verify the patient of interest based off the different parameters that are there. But that context passes over to the full service agent, whether they're in scheduling, billing, referrals, triage, or pharmacy in a central access or decentralized access center. You'll also see that we have a full notes history. And so you can now leverage some of these virtual assistants to drive context in terms of what happened between the patient and the virtual assistant. And so you heard in the transaction that Bill just had, Bill did a lot. He was able to verify in one call. He was able to list appointments in one call. He was able to cancel an MRI in one call. He was able to refill a prescription in one call and pay a bill and reset his MyChart password reset. But all that context is either stored in the EHR of interest or it's also persisted to the advocate and the caregiver that's answering the phone call. We also have a calling destination card. This is very important because, one of the things that we've done is we've mapped all the different dialed numbers that health systems might have back into what are the rules and the hours of operation? What are the scheduling rules and the decision trees that are scripted inside of that EHR? Um, we want to make it to where it is so dynamic for that caregiver to very simply understand this is the specific clinic or department that the patient's trying to call into, and here are the hours of operations and how to schedule for that specific clinic. Scrolling down, this is our 360-degree bird's eye view. It really gives you a high level view of a lot of the different metrics that are around that specific patient. And if at any point I needed to launch into my EHR, we have a quick menu and you can launch into appointment context, you can launch into referral context, you can launch into a CRM activity, you can launch into refill activities, or you can launch into a specific call hub activity as well. Here is also really cool. I mean, we're providing a drill down view of that specific skill type for each of the different Access Center members that are in your Access Center. So these are your appointments drilled down for your schedulers. This is your referral drill down. This is not just inbound, but it's also outbound as well. You can see the medical history. So you can see active problems, medical history, active allergies for your nurse triage team or your nurse on call team. We have a billing tab, so you could see all the appropriate bills that are due. You could see that Bill made a quick payment of a bill of $98. So that was really cool. You could see that inside of here very seamlessly. You can see if Bill is the guarantor or if he has paperless billing or if he doesn't have paperless billing as well. And then lastly, we have full medication integration into Epic Willow Ambulatory. You heard it from the virtual assistant side, but all the different EHRs, we have the pharmacy module, and you can very seamlessly go ahead and click that specific prescription request and submit a refill request into that EHR in-basket queue of type. So it's a very rich integration, but I also wanted to say that we just don't come with the full service framework. We also have reporting as well. And the reporting and data analytics are very crucial because we're not only capturing what the virtual assistant is driving with that specific patient, but we've scaled it up to what the full service is driving as well. Because at the end of the day, it's a partnership between these virtual assistants and your full service as well. And that's really what's unique with Spinside. There's many different virtual assistant vendors, but we also have the full service and the analytics that cut across both sides of it. And so you can see really quickly, this is a self-service scheduling tab, and you can see, okay, how efficient and what was the efficacy of Bill's virtual assistant and Spinside's virtual assistant as Bill went through it. What was the efficacy of him scheduling an appointment or listing appointments or rescheduling appointments or canceling appointments? We can even get into a stack grid where you could see, okay, at this date, at this time, this specific patient went ahead and opted to schedule, and they actually successfully scheduled. You can even get into a pie chart view where you could see how many folks of calls verified and then how many folks escalated to a live agent. And then lastly, we tie this back into an ROI model in terms of savings achieved, not only on the contact center side, but also on the business metrics and KPI side as well. And so the analytics cut across both self-service and full service. We have this also for pharmacy as well. And we also have this for billing as well. And we can drill down into these exciting dashboards and reports. But without further ado, I do want to pass it on to Justin to wrap up the webinar and go into Q&A. Justin?
Yes. Thank you, team. Thank you for the very informative demo. And thanks to all of you who attended and viewed our session. Please, if anyone has any further questions or wants more information, you can reach out to sales@spinside.com. And as a quick side note, we will be announcing our giveaway for the $50 gift card within the next week. We'll reach out to you directly via email if you were indeed the winner. But with that in mind, let's use this last 5 minutes to go ahead and address some of the questions that were asked within the session, starting with how does your IVA, Intelligent Virtual Assistant, differ from other self-service options, and how customizable are they?
Yeah, I think the big difference in our virtual assistant is we've partnered up with the major CCaaS vendors and we've integrated it into the CCaaS framework very seamlessly. So you don't have two different voice assistant platforms that are there. It's really one voice assistant framework that's integrated into your CCaaS of choice. The other thing that we've really worked on was the functionality. We not only just look at scheduling, but we look at direct and open scheduling. We not only look at billing, but we also have the full framework in terms of swipe and save, where we've integrated these virtual assistants inside of the EHR of choice as a PCI trust zone inside of the EHR, helping drive bill pay collections in an optimal way. We've not only looked at folks that have a dispensing solution, but we've looked at folks that have a non-dispensing solution, and we've looked at specialty pharmacies as well. So the functionality on the EHRs is what sets us apart. And I would say the last thing, Justin, that Bill and I really covered throughout the demo is it's not just self-service, but it's also escalating to the full service side of it. And we are the only framework from a virtual assistant standpoint that have scaled with the CCaaS vendors and have also allowed us to integrate into the agent desktop of choice as well.
Very good. Okay, so that being said, what specific automation tools or features reduce the administrative burden on the healthcare staff themselves?
Absolutely. So one of the things that we see time and time again that's repetitive and administrative is something as simple as a patient lookup. We're seeing, and I think you touched it, Justin. We're seeing up to about a minute and 30 seconds just to understand what is the patient date of birth, what's the patient medical record number, what's the patient zip code, and that's driving call handle time, and it's repetitive in nature. Another thing that we're also starting to see is, scheduling basic appointments that are there that don't have a complex decision tree that's associated with it. It's very repetitive and it's an 80/20 rule where 80% of the calls that are coming in are those simple visit types that are there. Of course, the other 20% that has a complicated decision tree, it will need a resource, and it will need a high touch advocate to help drive execution of that specific appointment type that's there. Uh, we carry that over into billing and pharmacy as well, both with checking prescription updates and prescription refill statuses and understanding pickup details as well to how I need to pay my bill. So those are some very intricate views where it's happening over and over again, and we're starting to see high containment rates across it.
Okay, I think we have time for maybe one more. We'll go ahead and squeeze this in. Is there a way to track and measure the impact of these solutions?
Absolutely. I think there's three different ways that we can track and measure. Number one is containment rates. That's very important. As you look at virtual assistants, how much call volume and how much chat sessions can we digitally and enhance from a patient experience standpoint? Again, these virtual assistants are working 24/7, 365. So it's very important to enable them the right way during hours and also after hours as well. Um, the second view is how much abandonment time are we reducing as we go into a live agent? So containment rate, abandonment rate in terms of live agent view. And then lastly, can we reduce the call handle time that resources are driving? And with that, I got fireworks. Justin, back to you.
All right. Yeah, I think we'll have to put a bow on this as we're out of time, but I very much appreciate you two and you being a part of this webinar. You guys did a very good job. We will be sending out a recording of the webinar via email within the next couple of days here. So feel free to share this with whomever you would like. It was a great session. Other than that, I appreciate all of the attendees who joined and viewed this session. And again, to the participants from my team, thank you very much. That's where we'll wrap. Everyone have a great day.
Thank you. Bye. Oh, I guess Ash left.